You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Dr. Brigitte, Piniewski, who is the CEO and co-founder of Block Health and also the author of Wealthcare and its latest edition. Welcome to the show.
Excited to be here. Thank you so much.
It is good to have you here. So that was a mouthful. So tell folks a little bit about your background and what your book is all about.
Super. So certainly I'm trained as a clinician. I'm actually a primary care physician doing obstetrics, spent the first decade of my career doing a lot of deliveries and really thinking that if we did those 9 months correctly, we would be launching people off to 100 years of good health. That was completely wrong. I learned soon after that, life can be very damaging to health. And what was hurtful to me was the fact that the children are the ones that are actually having to teach us this. I thought it took 4 decades of suboptimal lifestyle to give you heart disease, diabetes, stroke, but actually in our young teens today, just 4 years of a hormonally altered puberty can really change the future prospects for our youth in every domain of human functioning. Their vocational potential, social, educational, and so forth. And that really sort of kicked me out of medicine and seeing patients one by one, and thought I really have to get active in making sure that we understand that the medical model is completely out of date and that seeing patients one by one is not going to move the needle. I began working more with technology companies, became chief medical officer for a large reference lab in the Pacific Northwest, and we innovated with Qualcomm, Intel, and other technology groups across the international spectrum through what was called at the time the Continua Health Alliance. And then since that time, I'm also advising investors who are looking to invest in healthcare. And that work put me in front of many solutions that started showing up with blockchain-based components of their solution. And clearly, I had not trained in blockchain, nor had many of the investors. And so we began to set up investor education on blockchain specifically, put together a 2-week boot camp. And through all of that work, began to realize that we are really on the cusp of an amazing revolution for the way in which we use and benefit from data today. And we're seeing more and more of that as, AI has become part of individual households now. They're doing their own AI on their own devices. And so I think there's an opportunity here to really innovate in healthcare in ways that were not possible previously. And that's what drove me to write the book. We have so many people trying to innovate in healthcare, but they seem to be locked in still the Web 2 model, where they're doing these incremental innovations, where they're basically digitizing the current model and failing to really transform the future in ways that would allow us to not just 10x the value, but 100, 1,000x the value that we co-create together. And I'm hoping this book will be a good starter for anybody, regardless of where they are in their Web3 journey, to really pick up some vocabulary, read some very easy to follow concrete examples of what this means today and what it would look like tomorrow, and come away with a strong understanding and appreciation for the possibilities.
So we're talking about, healthcare innovation. This is a sick care system, not a healthcare system. These types of phenomenons that I think, a lot of people in the industry or even in the audience are going to be like, yeah, okay, well, that's not really anything new. So what is it that's so revolutionary about what you're saying compared to what we kind of already commonly know about healthcare innovation and transforming healthcare?
So I think then the number one sort of big message is let's right away dispel the myth that healthcare is operating with optimal intelligence, or even what we might describe as good or high intelligence. It is not. The level of understanding at the individual level is so low today, given the way in which we've created our intelligence through randomized controlled trials and study populations, none of which represent you and me on this call. And we still offer average, only average, to our patients because it's population-based medicine. So if I were diagnosed with breast cancer tomorrow, I would only be offered an average outcome. Yet not myself nor one of my patients want average. Everybody wants an optimal outcome. And so I think the big message here is healthcare locked in a Web 2 model will never be able to deliver optimal. We will only be able to deliver average. And so we rely on a Web 3 ownership economy that treats the individual patient not just to drive health, but now to drive value through the co-production of digital assets that will create a mechanism by which we, the people, can create a fire hose of truth for healthcare that will be specific for ourselves as individuals as well as for our communities. And so we should probably talk, what is Web3 and explain the difference.
So before we do that, I want to ask, what I kind of hear you saying is that, and correct me if I'm wrong, I talked to hundreds of innovators over the years, if not thousands, and it sounds like you're saying, even if all of those innovators successfully drove the adoption and widespread adoption and scaling of those innovations across the entire ecosystem in this country, that we would still be missing something pretty darn significant.
Huge, because just think today in Oregon, there are 70-year-old windsurfers on the water today. And none of the reasons why they're 70 and on a windsurfer is available inside the EMR. All of that information, those data points exist in the nuance of the way in which they've lived their lives. And that's all about gene expression. I think another myth is we think that you can do what, your health is better than mine because you have better genetic material. But at the end of the day, not one community has had a new shipment of genes. We're all still working with that same genetic pool. Yep. And so what's really changed over the last few decades is our ability to, in a sense, use the cards that we've been dealt and use them to our advantage. Because, as I said in the beginning here, the intelligence is too low. We don't know what's around the corner. And if we don't know what's around the corner, we cannot, basically have freedom and liberty to choose our futures because we can't see them effectively. And so I think that moving into a place where that minutia of, let's talk about that 70-year-old on the windsurfer today, it would have been impossible yesterday to ask them to digitize their health expression. Their health expression exists in the physical domain. But more and more we have wearables and apps that's making it easier for individuals to track their heart rate variability, to understand the ebb and flow of temperature changes, to pick up their step count, to even go on a machine and the machine will pick up the power, the reps, the cadence, and provide a lot more rich data stream around an individual performance. So converting our physical health expression into a digital health expression is becoming easier day by day. And what we haven't done, though, is make it possible for individuals themselves to benefit economically from doing that. And that's where I think the ownership economy and the Web3 ethos is absolutely revolutionary.
Okay, so let's do it. What is Web 3.0 for those that don't know? And then give us some context of Web 1, Web 2, so that we can kind of know where we've been and where we are and where we're going.
Right. So starting with Web 1, of course, that amazing thing that showed up that was called the World Wide Web. And suddenly all you needed was a connection and you would have access to just a plethora of information. So rather than reading something on a piece of paper, you could read it on the screen. What's fundamental there is the same functionality and the same sort of value was available to each of us. And that's why the World Wide Web is a very appropriate name for the first iteration of the internet. But what happened is we took that internet and we started to add functionality such that you could do commerce on the internet and have websites. Suddenly, it was no longer the same for all of us because corporations could take advantage of e-commerce and websites to a much greater degree than just you and I.
Mm-hmm.
And what happened with that phenomena is you suddenly had a massive widening asymmetry of data management and data control, such that now we're left with just a handful of very large players controlling the vast majority of the digital behavior going on the internet today. And that's the internet today is what we call Web 2. This phenomena with a handful of major companies creating large business models on top of data that you and I and others are contributing to on a regular basis. Now,
And I've heard FANG, I've heard the word FANG or the acronym of FANG, right? Facebook, Amazon, Apple, Netflix, and Google, right? These are the dominant Web 2.0 players, right?
Mm-hmm. And healthcare has its own,
Yeah.
think of EMR vendors, etc.
Uh-huh.
But let's get on to Web 3 then. So Web 3 is this ethos that says, hey, we don't have to give up and say, this is it. This is all we've got. Can't do anything differently. Web 3 says, no, we are mathematically fortifying the internet such that it will be absolutely possible for you and me and the non-savvy, non-tech savvy folks to actually own, manage, and control our own data. And we do that using blockchain-based solutions, self-sovereign identity, and zero-knowledge proof, NFTs, a whole new vocabulary of functionality that when you're new to this phenomena, it's not something you're going to pick up in an hour. You do need to spend some time. And like I said earlier, we put together these 2-week boot camps for investors because there is new vocabulary here. But what's so exciting about it is the potential for very new business models. So imagine a physician, actually even the healthcare industry. AHIP is a very large payer conference, and it happened last week here in Oregon. And the overwhelming sentiment was fear and trepidation around AI taking over the business model and disrupting it sufficiently, such that, what does the future hold?
Sure.
And that's where I think these healthcare providers need to start thinking about moving beyond the traditional model of driving health in patients using EMR data alone to this new model of partnering with patients, families, individuals in that co-creation of a longitudinal health data set that includes the nuances, the vast majority of which are not in the EMR today, and sets up a mechanism such that individuals can now participate in that co-creation of health intelligence and participate in data marketplaces according to their own specific needs.
And I think that what you're touching on is so important for all of us in healthcare to really grasp and grasp quickly, because in my mind, the tech companies get it. They understand the value of the entire holistic data set of a human being, right? All the consumer data from A to Z and a multitude of places, and the value of aggregating that and then being able to leverage that in a number of different ways. Whereas what you're saying, makes me think of what's happening in healthcare is when we're talking about bringing all the data together into a centralized system, it's still like this very disparate, episodic data that's just this traditional health data and not all the data points that you're describing that are completely missing. And if we don't figure out that value and figure out a way to build businesses around that, I keep saying these technology companies are going to come into healthcare like they're doing now and eat our shorts because they get it. They're doing it.
Yes, exactly. And we've begun to even quantify, the social determinants of health. We talk about that being 80% of health expression. I think when you mention the tech folks get it, especially those working in AI, they understand that the training set is everything. If you do not have the data, the AI will never have insights into that spectrum.
Yeah.
And we as biological beings, we always we only exist in the physical realm, and we have to put effort into taking that existence and replicating it in the digital realm sufficiently such that AI would have access to it. And that's not something we want the big players in healthcare to do for us. We don't want our healthcare providers to understand the minutia of our lives.
Yeah.
We would love to be able to, yes, understand the minutia of our lives in safe and protected ways, and be able to only open up our records according to specific needs at specific times. And that would have been an ask that was too large for either individuals or tech companies until relatively recently, until we became more and more conversant in these new technologies. And that's what I really liked about your previous guest on your podcast, Troy Bannister. He didn't look at healthcare to find out what to do. He looked at industries outside of healthcare. For instance, Plaid, and said,
Yeah.
"Hey, Plaid's doing a great job connecting banks. Obviously, today, because of the Cures Act, et cetera, it's possible technology-wise and regulatory-wise to connect records." And that's the beauty of the solution at the end of the day, is that we as individuals, we are free individuals. We're not covered entities. So with our health data, we can do whatever we choose. And I think that if healthcare systems start to recognize that by partnering with the, through 3 million people in their roster, they are not going to lose access to their market share. They're actually going to co-create a 10x, 100x, 1000x greater value in terms of health intelligence. And of course, George Gilder talks about how all real wealth creation is based on new knowledge creation. And this is where, the foundation for the book, calling it Wealthcare,
Yeah.
is why we decided on that title.
So, so let's walk through for those that are still, their brains are really hurting and they're really going, yeah, I hear what you're saying, but it's still not clicking yet. Give us a kind of use case scenario of a person or a situation currently in the 2.0 world, and what's working and what's not working. And then that same kind of scenario, what that might look like in Web 3.0.
Yeah, if we just think of it in terms of numbers of transactions, today you and I might have had a coffee, maybe bought something online, maybe 1 or 2 transactions. But imagine a world in which you're constantly wearing 1 or 2 wearables. It's picking up your data points. You've already pre-authorized where that goes. Perhaps you're in a group that is looking at the benefit of yoga for migraines, and that your data is streaming directly to the group that you've authorized that to happen. And then there are companies and industry looking at this group to say, okay, there are new products and services we could build for this group if we knew what they needed. And so at the end of the day, while we're having this type of a conversation, rather than just having 2 transactions, there might have been a couple of 100 transactions happening in the background on your behalf, all pre-authorized and all exquisitely auditable, such that none of the requests that you have not authorized are capable of happening. And so you would be able to go to your phone and be able to see the numbers of transactions that have occurred, that in fact they have gone according to your wishes, and keep track of what type of, tokenization has accumulated since your view.
Wow. It makes me think of, I had a past guest on the show, Nick Kahn, who invented a toilet seat with built-in sensors that, you think of the devices that we have today where that really requires some kind of human interaction to be able to click start or to be able to do something to start collecting that data. Or if you compare that to, a person like you're talking about going into the doctor's office twice a year and having their blood pressure measured, single pieces of data. Whereas if they're sitting on a toilet, you've got, it's passive, it's more continuous because that's happening every day, probably a couple of times a day. But that's still really only one device. It's only one type of health data. It's not all of the other data points that you're talking about that really give a lot more context into what's happening in a person's world that might influence their health.
Yeah, and that's clearly, you're opening up a conversation around new types of professionals in our lives. And they may not be our primary care physician. They may be somebody who is a cross between physician and tech person that says, hey, Dr. Roxy, you've been tracking just your toilet data. But in fact, if you also tracked your sleep data, then your laboratory values would be much more valuable in the open market. So, for instance, it's crazy that you and I have the same cholesterol thresholds. Actually, probably everybody listening to this podcast that are adults have the exact same thresholds according to healthcare. Right. Again, that's speaking to offering you average and trying to have a cut point for when I can prescribe you a medication or not. And so imagine a future where now we're all talking about what's reachable, and we can say that your HDL was 14, that's way too low. But in order to move it up, you want information from your cohort that says, okay, we did these things for this amount of time, and we moved our HDL from 14 to 44. And that's the type of high definition, high specificity healthcare we should be delivering today, given the fact that we have the technology tools to do so. And yet healthcare still is, as I say, one set of standardized values. We're put it across the entire population and say, this is, quote, what normal is. And normal, of course, has nothing to do with optimal. It's just, when do I need a medication? When do I not?
Right. Yeah, exactly. I can't really so what you mentioned other industries earlier. What are some other industries that are ahead of healthcare when it comes to leveraging some of the technologies that you're talking about?
Oh, so of course, the finance industry is doing a great job. And the beauty of the finance industry, it reminds us that we don't need a revolution to do things differently. Bitcoin showed up just beside finance. It didn't do anything to finance. Finance operated as usual without any interference from Bitcoin. Yep. And then there it is. Now it's still there, over a decade later. And it has provided us with an ability to not just theorize about doing things differently, but actually do finance differently. And so certainly finance far ahead, understanding the tools, understanding how to create value on top of value on top of value is really well done in finance. The industries closer to healthcare are certainly supply chain. So, the food supply chain and other supply chain examples. I talk about an example in Australia, actually, which used tokenization for all of their alcohol because the country was missing so much on alcohol taxation. that continuously magically was lost.
Money
And
talks, right?
yeah, exactly. So if you tokenize each and every bottle of wine, suddenly the tax for that bottle of wine starts to show up where it's supposed to. And yeah, so these are very, in a sense, straightforward examples of how the technology is taking the work out of, systems that used to be kind of hairy, complex mess, like alcohol taxation.
So some people that are listening to this are gonna or are thinking, um, that sounds great, but I'm bringing a solution to market right now. This seems, kind of, I don't say far-fetched, but this sounds like something that's going to happen in healthcare maybe in the next like 5 to 10 years. And I'm building a business and I'm innovating right now. What do you have to say to them? Demystifying or debunking some of those myths around what can be done and should be done right now versus, oh, that's something that I'll think about later.
No, I think it's perfectly fine to be launching something right now in healthcare. If it works, I'm sure it's very much needed because there's so much repair needed in healthcare. So don't at all feel that you need to start right now with Web3. You don't. It can be a stepwise progression to a Web3 ethos. And so, for instance, the founder of Chobani Yogurt, he has a good example of, set up the typical corporate structure, had his employees, created this massive success, and then later on kind of converted to a distributed model where the profits went to the employees. And so that's a perfect sort of simple example of even a Web2 model that can become more distributed and more call it matured into a Web3 ethos.
Sure.
And so I don't know that I'm asking anybody to stop what they're doing. Clearly, I think start thinking now, what does Web3 mean to my business? How does that change the way I promise to behave with patient data? How does that change the way I promise to, not exploit an individual's ownership of their own data? And how do I design in down the road a more distributed model?
Well, and I think to myself, all the times that I'm having conversations with innovators and they're like, Roxy, let me tell you what I'm doing. It's so exciting. It's never been done before. And I'm like leaning in really hard, excited to hear what they have to say. And then they start talking and they start telling me their story, their model, their offer. And I'm like, I have heard this innovation 5 times in the last 2 weeks. And so, you've got like, we don't need another app for a symptom checker. We don't need another solution for a patient communication tool or a patient engagement solution. So for all of the unique, revolutionary innovation that's out there, we're starting to get commoditized in some of these sectors. And so, I think for those that are listening, and instead of coming up with a Me Too business model, and you want to be the 50th one that's kind of offering the same thing. I mean, what you're saying is, in your book, you're giving people a roadmap of how to truly disrupt whatever the industry or sector is that they're most passionate about, and helping them dream and rethink about what their business model could look like in the future so that they can be first to market, they can have a stronger competitive advantage and not be in the sea of Me Too's.
Exactly. Yeah, like you say, we don't need another symptom tracker, but we do actually need to know if yoga is better for migraine than something else. We need to know that now. And we do need to know if we're diagnosed with stage 4 colon cancer, what do I need to have an outlier experience? We do need that, and it would be possible. And so I think innovators can start to dream bigger about the specificity of the types of answers they could provide. Today, we can't Google any of those questions, but in a future where we're co-producing value, and now we're not talking about just a handful of data companies, but billions of individuals acting as individual data companies themselves. I mean, remember the stock exchange in the 70s used to have something like 700 companies on and have, some level of value. And now there's 33,000 plus companies on the stock exchange, and the value creation has been huge. And so getting away from this mindset that I can't support this because it's going to interfere with my market share, I think start to really open up your minds as innovators and not think about competition against each other, but how we can co-create a much bigger pie together by
Okay.
really leveraging the individual. Because the individual today is all on standby. We're all waiting to be told what to do when.
So I have, every time you say this word or some variation of this word, I'm like, mental bookmark, mental bookmark. If anybody's been following any of my stuff on social media or even episodes of this show, anytime I have an opportunity to talk about co-creation, oh, that's one of my soapboxes. Like, we are not co-creating enough. We've got a sea of innovators that think that we have all the answers to all the solutions that are needed. And so co-creating solutions with consumers, to me, is like the holy grail strategy for having commercial success. So tell me what you mean by co-producing and co-designing and co-creating, and how does that fit into what we're talking about today?
Yeah, so when I think about co-creating, I really think about creating that fire hose of truth. The fact that so much of our biological truths remain silent today, that we're using AI on EMR data alone, useless or very low quality in terms of the outcomes. We're never going to get to that windsurfer, that 70-year-old that today. And so this co-creation for me is delivering that fire hose of truth that as a society, we've never needed it more. We're building AI now on the cusp of building, artificial general intelligence. And we talk about alignment and protection into the future without a fire hose of truth coming by, from the people, by the people on an ongoing basis, giving us very high fidelity digital understanding of what's actually going on the ground. We're not going to be able to align AI, and we are not going to be able to take control of our futures, as I said earlier, unless we can see around the corner. And that means having a much greater voice coming out of the ground. And we can't ask industry to do that. We actually have to ask individuals to do that. And we can absolutely remunerate them for that effort in ways that are likely to provide us a path to universal basic income. Imagine that you don't have a job anymore, but you have the time now to go to the gym and create more of that instrumental data that we were talking about that informs the system what happens to 60-year-olds when they're not employed, but they can spend a couple of hours in the gym creating more data to allow us to understand what's reachable for 60-year-olds in, Oregon in the 2020s, for instance. And so that different model
here.
Pardon?
I said, oh, you're speaking to the heart of some people here.
Okay. All right.
Getting 4 or 5 hours in the gym every day.
Yeah, so don't let that go to waste. And right now,
Right.
so much value is going to waste. And you even think of our poor clinicians who are burnt out from COVID. And can we not create a better business model where now these clinicians are co-producing value with their patients that actually gets tracked and tokenized? And so when I, find celiac disease in my patient and I turn them from an individual who couldn't go to work because they couldn't figure out what was wrong, and now we've figured out, some of these more challenging diagnoses, that tokenization of that information and the the minutia around how did we get that right finally is added to the system. And myself as a provider, I now have a tiny stake in, say that I've got 2,000 people on my roster. I have a tiny stake in terms of the value these 2,000 people are creating on a daily basis. Yeah. And so we talked about you seeing your value creation, but also clinicians and practitioners and digital fiduciary, new type of professional out there creating value with this opportunity to do that so safely, effectively, and in the control of the user using these Web3 approaches.
So what do you think is the awareness of consumers, or even the appetite from consumers, to be able to harness and monetize our own patient data, kind of getting to more of the, personal data economics?
Mhm.
Where are we? I talk to so many different people that are like, what we need is we need patient health records that are owned by patients and managed by patients. And but they're really struggling to figure out, like, what is the business model for that, because patients, consumers, aren't willing to pay for it, and the providers, if they pay for it, then they're owning it. So how do we solve for that?
Yeah, and so I think the consumers are aware of it in pieces, right? So consumers get that there is an opportunity to understand what's reachable through apps like Strava, where they, every time they do a run or a ride, they can see, oh, 800 people did this ride. I'm at this level of performance within this group. So they have some picture of the fact that, hey, by using crowds, I can understand better how I'm performing. And then the
Mhm.
other cohort that really understands that we need much better access to high fidelity understanding of what's going on are the groups of individuals likely your age or mine that are looking after older parents, and they can be remote, and you're going, well, what does my mom need? Well, clearly the EMR is not telling me what my mom needs. I
And
need
neither is she, right?
yes, and so
She's
I
not
need
a
a co
voice of truth.
yeah, I need a cohort of, a few thousand 90-year-olds, and what worked with them and what didn't work for them in terms of household day-to-day scenarios to actually get it right for my mom. So today we have so many people struggling to get answers that even with all the technology and all the searchability that we have, there are no answers to be had. You are constantly reinventing the wheel every time you're
Mhm.
trying to support an older person navigating the healthcare system. You're having to relearn where are there missing records, where are, so and so doesn't know this. And so this patchwork of struggle is something that the group that is currently trying to look after the older generations is very savvy about, and would love to be able to just ask the question. But there is no place to ask yet today. And so I think that's why we have this concept of diverse data marketplaces, where not just researchers and industry would be purchasing data, but even us as individuals, we're generating tokens ourselves. Let's use those tokens to ask the questions that we need to ask. Another group that is very, sort of an easier or an early adopter are the high performance athletes, of course, because their health is their wealth.
Yep.
And the idea of getting one or two opinions just is crazy when I might have millions riding on my joints, my two knees and my
Yeah.
one back, getting
Mhm.
a couple hundred or a couple thousand opinions from thousands of people that went before is completely doable given the technology we have, but we just need to make that a reality. And so I think more and more younger generations are becoming more comfortable with technology, and so converting their physical expression into a digital expression and participating in open marketplaces is just something that's going to be coming natural to them.
Yeah.
And being sort of data laborers, if we call it that, providing data labor by producing data so that I can get more tokens, so I can participate more, so I can ask more questions, just going to be a normal phenomena for the next generation. And actually, they're the ones that are so desperate to make this happen, in fact, or desperately in need, even if they don't know it. Because I
Mhm.
always say, you and I are the last of the accidentally well. Your parents didn't have to know how to move you. They didn't have to know how to feed you. You just sort of accidentally got good access to your genetic potential, as evidenced by your vocation and your socialization and, physical attributes, etc. These things you didn't necessarily earn or deserve. They're just there by virtue at the time you were born.
Yeah.
And that's not there for the younger cohorts now. We have rearranged conditions on the ground so severely that now you actually need technology to be able to have access to your full genetic potential. Otherwise, the opportunity to miss it is much greater than the opportunity to actually access your full genetic potential.
Wow, we could talk for days, but I know we've got some best practices on attention span here. So
Totally.
let's go ahead and wrap up. Is there anything else that you're like, just, I want to make sure your audience knows about this as we wrap up here?
Okay, I would just mention that, yes, I released a book, but I also released a book as an NFT, which is perhaps not well known by larger audiences, and that's available through Alexandria Labs. And the beauty of the NFT is it's a digital first or a digital only edition of the book that then allows the owner to be absolutely sure that it will always exist for them. Unlike, if I have a physical book, it could disappear. I could lose it on a plane. I could uh, somehow, even if I have my book on as an ebook, that means that I have to rely on Amazon or Kindle to exist, because if they decide to, for whatever reason, they're not going to support or host my ebook anymore, I don't have that ebook, it disappears.
Right.
And so there's these new models now that we're all tinkering with and beginning to understand, is this opportunity to take content and make it available to new digital first medium that allows me to control that content and all follow on value that's produced. So for instance, if you buy the book as an NFT and then sell it to someone else, a small portion of that royalty can come back to the original author or the original owner. And likewise, if you have, a first edition and it gets sold again and again, those follow-on sales can accrue back to yourself as the owner of that, first edition. So very different ways of thinking about business models, and very inclusive, and tiny value can be tracked, tokenized into perpetuity. Like this idea of the past, our healthcare keeps asking us to sign over our data, but they don't give us any benefit from that data, suggesting, in the Web 2 model, it'd be too hard to give people value back in the Web 2 model. But Web 3, it's not hard at all. Tokenize it, and even if it's a tiny fraction of value contribution, we can keep good tabs, because we're not doing it, of course, just the software. And the software does not forget, does not lose its pieces. It can keep track of value that's been accrued to a specific algorithm or some other product and service in the future. Those contributors can be tokenized in ways that make perfect sense to those that are well versed in this space, but I think are new ideas for those that are just approaching the Web3 ethos.
Well, it sounds like a DSR model, business model for every individual person who wants it, something that's digital, scalable, and residual.
Mm-hmm.
We want that business of the future.
Yeah. Yeah.
Well,
So
it sounds like practicing what you preach.
Good. Yes, exactly. I'm always learning, always learning. It's not like there's an expert out there.
Right. Yeah. Well, thank you so much for joining me today. How does our audience get a hold of you if they want to learn more? Or if, maybe just recap, how do they get access to your book?
Yeah, so it's available on Amazon. It's called Wealthcare, and Demystifying Web3 and the Rise of Personal Data Economies. Actually, if you just Google Wealthcare and Brigitte, it comes up right away. And then you can get a hold of me on LinkedIn at Brigitte Piniewski. And I would, if readers or listeners want to learn more, there's some great books that are not that are not healthcare specific, but for instance, Life After Google by George Gilder, or Life 3.0 by Max Tegmark. And of course, Shoshana Zuboff's Surveillance Capitalism is a great book to understand why Web 2 is not serving us well, and why we need to move to a much better model. And then there's the Ownership Economy podcast, if you like podcasts. And then, of course, Lex Friedman, if you're a podcast junkie, that's a one not to miss as well.
Awesome. So you've got some how-to here, some practical application for anybody that's interested in going further.
Yes, please.
So thank you so much for joining me today.
Thank you very much. It's been a pleasure. You've certainly made it easy to chat about these topics.
Thank you. Thank you so much for listening. See you on the next episode of Health Innovators.